Are you feeling extremely fatigued, exhausted, and having a hard time getting through your day?
Then stay tuned as we review the most common causes of fatigue and some very powerful and unusual solutions. Hi, welcome to Sage Health TV. I'm Dr. Angela Yeagley, here with my friend and colleague, Dr. Anastasia Jones.
Hello again.
Today we're going to be talking about the most common causes of chronic fatigue. While there are many different medical concerns that actually can contribute to fatigue, we're going to review the top ones that we see that actually can help people no matter the underlying cause. And what that means is that if someone has certain types of chronic illness, that can also be causing fatigue in that person. We're not talking about chronic illness today. However, the things that we're going to talk about can help that person if they have, say, an autoimmune condition or significant cardiovascular disease, or other significant illnesses that can be kind of wearing them down a little bit. So one of the first things that we would like to talk about today is adrenal fatigue, along with thyroid, underfunctioning of the thyroid.
Yeah, and both of those are two big issues that I see come up a lot with patients of mine. Sometimes one, sometimes the other, and sometimes both, because the adrenal and the thyroids work in tandem together very closely. So if one is pretty sluggish or overworked, the other one will try to pick up the slack. So we always want to evaluate for both. With adrenal fatigue, that's something you're going to see. A lot of people can have it, but I'll often see patients that are, really high functioning, really go-getters that are just busy, stressful life, maybe have a few kids, they're working out, they're just trying to do it all, right. Doing the superwoman thing.
Common, right?
The superwoman or the superman thing. And, what's crazy about the human body, we're so good at compensating, right? So we will, we'll keep ourselves, pedal to the metal. We'll just work and kind of push through. And our body will compensate. We'll make the stress hormones we need, and we'll get by on less sleep and stuff. And then, we'll compensate until we can't anymore. And then oftentimes people will sort of rapidly decompensate.
Right. And feel super tired, super fatigued.
Exhausted, maybe start feeling some other symptoms that go along with that. But so with the adrenals, that is something that you can get a lot of just from a history, like really sitting down and talking with a patient, getting a sense of their lifestyle. What are your sleep patterns like? You always want to look for the horses before you look for the zebras. So you want to find out, well, are you how many hours are you allotting yourself to sleep? Are you eating meals regularly? That kind of stuff. And then we'll look at the adrenals. We can do, there's a great test for that. It's a saliva test that looks at cortisol secretion over a period of time, a 24-hour versus just a one snapshot once, in the morning or
one
something.
Test, right.
Yeah. And it gives us kind of their cortisol curve and lets us know, where are they at? Do they have a lot in the morning and none in the afternoon? Or are they just kind of flatlined? And that can be a really good starting point with how to address that, if that is the cause. And once again, thyroid's important to look at too. We went very in depth onto that in our show last week. So if you didn't get a chance to see that, check that out. And then, approaching the adrenals.
Right, exactly. There are there's so many amazing treatments that we have for adrenal fatigue. And today, Dr. Anastasia and I would like to go over a couple of our favorites because there are so many. And we do use many, but the first one I know that you were going to discuss.
So one thing I love, in addition to some of the nutrients and definitely some lifestyle changes, which I won't really get into here, but are super important, is I love an herb called Holy Basil. It's also known as Tulsi. It's an Ayurvedic herb. And it's a great one. It's an adaptogenic herb, meaning it helps the body regulate its cortisol secretion and helps our body regulate and adapt to stress. So that's a great one for people who are maybe feeling they're tired, but yet they also feel edgy and anxious. This one is very grounding. It gives gentle energy, and it's also really, really good for the immune system. So I think that's a nice one on its own with, some other nutrients or in an herbal blend.
Yes, absolutely.
Which one do you really like?
Actually, I really prefer, I use several several, but I really prefer Rhodiola. I think that's maybe one of my favorite herbs. Yeah. So it's also known as Arctic root, and it's an herb that was studied on Russian athletes, and what they found is that it increased performance time during their workouts. And these were Olympians, these were competing on a high level. So it's a very stimulating herb. So people could reach for this instead of like their extra coffee in the morning or in the afternoon. While, not overly stimulating, doesn't feel like caffeine. However, that said, like I definitely, if someone tended to feel it a little, even though they're tired, a little anxiety or feeling a little too stimulated, that might not be the herb for them.
Yeah. So once again, with any treatments, we really want to customize it to the person and really base it on their constitution and their symptoms and their
and the other concerns.
Yeah.
Right. Yeah. And so, and what you said about Holy Basil, I love because of the immune system support. Yeah. And which kind of brings us to our next common cause, which is infectious. And so one thing that we really screen, so along with the adrenals, because this is so important into your overall functioning, we want to look at do you have something that's potentially wearing you down, And it's really common for people to have exposure to what we call different monotype viruses. You've probably heard of mononucleosis, and most people think of it as like the college or high school kissing disease, right?
Yeah.
But nobody has to kiss you to get this particular virus. Somebody can just cough on you.
Yeah, that's not as fun.
Not as fun. And it's highly contagious. So by the time a lot of people will say, well, I had mono and then it's gone, but actually that's not true. What happens with that particular strain of viruses is that they stay in your body for the rest of your life. And what they do, so how they re-manifest later is they start replicating when you're stressed and you're run down. And what's their primary side effect? Fatigue. So they make you tired. And in some cases, they make you feel like you're getting a little sick. And then you rest and you're like, oh, I'm fine. I didn't actually have anything. Well, you did. It was just your monovirus kind of rearing its ugly head again.
Constantly just on the cusp of that.
Right.
That little bit of a sore throat or a little, the first signs, and then you get a little rest and it goes away.
Right. Exactly.
But it never goes all the way away.
Right.
Because, you're back onto the next thing. And so it can be a really, I recently had a patient, actually, I just got his labs back last week, and he's been really exhausted and really run down for years. And he clearly has some adrenal issues, but I also tested him for this wole family of viruses. These all fall into the herpes family of viruses.
Yeah. And they're not herpes.
No, they're not herpes like
just
you
mono.
think, but but I mean, they're viruses that behave in a similar way.
Yes.
Like they go dormant, you don't clear them completely. He came back, of the 4 I tested for, he came back with super high levels, high titers or high levels of antibodies to 3 of the 4.
Yeah.
Like just really high. So
huge
it's like,
impact.
oh my God.
Yeah.
Good news is the treatment for them, because they're all in the same family, you can treat all 3 of them simultaneously with really the same treatment.
Yeah. And we have a lot of those things. So there are a lot of fantastic natural antivirals. So we look, again, we don't often just target pick one thing. Many times there's a lot of blends that we use. But for instance, one thing I really love that has been studied to kill Epstein-Barr, one of the main monoviruses that people tend to know about, is an extract from coconut, surprisingly, called lauric acid. So it's been studied that it will reduce the levels quite a bit. So we tend to be successful.
It's really, really effective.
Yeah,
that's what I found.
Very effective. And I know you really there's another herb that you really like as well.
I will usually use the lauric acid in conjunction with several herbs. But once again, one I often start with is called olive leaf. And that one seems to have a really high affinity for that type of viruses. And it also boosts the immune system directly. So it can work on a couple of different levels.
Yeah, so
they
combining
complement.
it. Right, they definitely work together. All of this, functioning of the immune system and the functioning of the adrenals and all comes back to, your body is pulling on resources. And so that brings us to nutritional deficiency, which is another really common cause of fatigue.
And that is definitely something that can be ruled out or ruled in very early on. If somebody comes in, just with doing really routine blood work, we definitely want to, just make sure those basics, those foundations are in place. So, anemia is one that comes to mind, I think, for people really generally, it's like
low anemia, low iron.
And I feel like, women tend to get checked for it more often than men, but really men can be anemic too. Sure. And when we're only looking at a CBC and looking at a hematocrit and a hemoglobin, which are the main markers, some of the main blood markers, we can miss anemia. We can miss because what can happen is people's ferritin, these are iron stores, can be really, really low, but their other numbers can be normal. Essentially their blood cells are conserving. It doesn't want to use up the stores that are so low. So the iron that's circulating in those red blood cells is old. It's not functioning that well. It's not carrying oxygen well.
Right. Yeah.
And so people are told, oh, you're not anemic. But when in reality, their ferritin levels can be, I've seen people with 5 or 10 when really, it's a really broad range, but I at least want to see people over 50. Yeah. Especially if they've got fatigue. Yeah. So that's an easy one. Vitamin D is one that it's like, oh my God, here goes vitamin D again. Everybody talks about it, but I still have people coming in. We live in, the Pacific Northwest. Right. It's, it's gray a good part of the year. And people are still coming in who are not taking vitamin D and who have never had it checked. And I've literally had people come back undetectable. That's not that common. That's under 7, I think.
I would say low is more common.
I've had a couple of undetectables, but commonly I've had lots of people in the teens or
just
low double
really
digits,
low.
So like 10, 15, 20. Some things say normal is 30, but we really I want to see it like optimal's 50 and above, maybe 80.
70 to 80 is the vitamin D research council like optimal setting. So
that one's a pretty obvious one, and yet it's missed a lot. And then B vitamins. B vitamins are super, super important. So it's like whether you're getting a really broad diet and getting those B vitamins, the B12, the B6, the folate, all of them really are important for energy. Yeah. And then, or you're taking them, but your body is not utilizing. You're either not absorbing them or you're not converting or metabolizing them properly into what you need.
Or you're not getting the correct forms.
And those are so easy to check for.
Yeah.
So
simple blood test, which kind of brings us to, as you mentioned, like the utilization of those Bs and maybe the correct forms of those Bs kind of brings us to mitochondrial and metabolic dysfunction as our last common cause of fatigue. And this can actually be quite, it's a pretty big subject.
Yeah, it's a big topic to cover. But
and actually, this is something we're going to break out, and we'll have a future episode just on this subject. But one thing I want to mention, so when we're talking about mitochondria, these are our little powerhouses in our cells that create energy. They actually make something called ATP, which is the energy that we live on. It's one of the things that powers us to move our muscles and create brain neurotransmitters. And so anytime we do anything to increase mitochondrial function, we are going to feel better. So what are the things that we look for related to the mitochondria? And so one of the big ones that is becoming a little more well-known is something called MTHFR and methyl, I'll explain it along with methyl tetrahydrofolate reductase.
It's a mouthful.
It's a mouthful,
sure,
yes. And so what this relates to, when we look for MTHFR, what we're looking for is a need for particular nutrients. So there can be a genetic need or a genetic predisposition for almost towards a difficulty with the metabolic processing of these vitamins. And so the need is higher. So your need, if you're positive for this, your need for these things are higher. And so you might be taking a regular B vitamin. And so there's a couple things I would say about that.
So it's not just a higher need for more of just any B vitamin. Sure. It's got to be very specific forms because if folic acid's a good example. People could take tons of folic acid, but their body, if you're MTHFR positive, more than likely not able to convert it to folate, which is actually what's involved in all of these chemical reactions in the body. Right. To make neurotransmitters, to make hormones, to detoxify the liver, and to fuel our mitochondria.
And make that very important energy that we want to have. And so, but, it's not just about the folate. It's about the other forms of B12, and it's about other amino acids, methionine, inositol, choline. And so we want to evaluate all of this. And really what this test does is it helps us go deeper into the understanding of what your body specifically needs. And then there are other markers that we can look at that relate to this too. And those are antioxidant levels and the other genetic markers. And one thing I wanted to mention, a friend and colleague of ours, Dr. Ben Lynch, has just recently come out with a book called Dirty Genes. And we are so excited. This book is amazing.
It is fascinating to look at what are, you hear about genetic predispositions. And this actually, since the genome's been mapped, we're able to test people and look at, okay, do they have these genetic SNPs, or do they have these? And then what can we do to help prevent them from expressing them in a negative way, or support them being expressed in a positive way, right? It's called epigenetics or nutrigenomics.
Right.
And it's a really exciting field because it allows us to just not be victims to our genes, but it allows us to help guide people to make really good choices and educated choices around their health.
So Dr. Ben Lynch does an amazing job at reviewing kind of the top ones, including MTHFR that I mentioned today. Great content. But we love to work with this too. And we love to, all of it's tied together, and people can actually have multiple things. You could be iron deficient and have adrenal fatigue and be positive MTHFR.
And sometimes, you don't want to get too much into the chicken and egg thing. Like, did I have this first, or did I have this
Maybe
first? Was my immune system low and I got the EBV and that made my adrenals fail? It doesn't really matter. What we want to do is identify all the, all of the factors, all the causes, and start to get people feeling better.
Right. Yeah. So thank you so much for joining us today. We love this subject, and we love seeing people for fatigue. So definitely let us know today. Love to hear your thoughts. And
if this is something you're struggling with, give us a call.
We'd love to see you. Absolutely. Yeah, we'd love to see you. And you can reach us at sagemedclinic.com. Thank you.
Thanks so much. Bye-bye.